kinds of terrific specials throughout the year, like VIP savings events, but every single day when you have the HSN Charge Card, we offer Flex Pay. You can add an additional month. So it's my favorite card. I love my Flex Pay. I love my additional Flex Pay when we're able to do so. Okay, we did a little sneak peek of our under eye smoother, and I was mentioning, unlike anything else, and this is what Dr. Nassif does. So we were just talking about cleansing the skin. He takes it to the next level with the detox pads. Yes, there are a lot of eye creams and smoothers out there. There is nothing like this hydration and truly addressing textured skin around the eye. Really one of the most difficult thing, where it's, you know, again, not only, it could be up to the look of texture, it could be, you know, that very thin, tissuey look under our eye. That's one of the most difficult areas to really see a difference. Look at this before and look in this after in the smoothing appearance under your skin. Not to mention, I was mentioning how your makeup, and I'm gonna have Doctor explain that to you, goes on so much smoother, so much easier. And here's another example of, you know, addressing so many different issues, even puffiness and all of that. So Dr. Nassif, you're getting a 2-pack today for $20 off. It's normally $69.99. This is also a customer pick favorite. And we also have it available on auto ship because people asked you that they do not want to be without it. So you can customize your auto ship on this one and secure this $20 savings. But what sets your eye anti-smoother apart from any other eye products out there?
Absolutely. You know, it's all about the key clinical grade ingredients. But first of all, let me talk to you about the lower eyelids. So as you all know, I'm a facial plastic surgeon. The lower eyelid is very delicate, very thin skin. Now, I don't know if you ever seen me on Botch, but we're actually doing a lot of reconstruction for patients that have had lower eyelid surgery gone wrong because that skin is really, really gentle. You got to be careful with what you do. So what I did, I took 3 different 2 peptides and 1 polymer complex. And these peptides, first of all, let's talk about our EYESERYL. Dark circles, we help with that. Puffiness helps with that. Crepey skin, the wrinkles like you saw in those before and afters. And you can pop through some of these before and afters too as I'm discussing this. So I want you all to stare at the, shall we say, the befores have the lack of hydration, the fine wrinkles, the discoloration, the puffiness, basically the lack of radiance. And what we did is we took the EYESERYL, okay, that's number 1, my best peptide, but then we added something called pinoxide. It is a second key clinical ingredient which really supports collagen levels and also helps with microcirculation. You might even feel a little warmth as you put it on. That also is helping decrease the appearance of the dark circles underneath the eye. And when you look at those befores and afters, look at the texture of the skin. Now, this is the long-term use, but let me tell you also something about the immediate and short-term use with this. There's a polymer complex called LIFTONIN XPRESS. As soon as you put it on, it tightens that skin. It helps get rid of the wrinkles and the crepey skin look. So we're doing that for you. So you have 1, the immediate and short term, so make sure your eyes look great when you put it on, then you can put on your makeup. 2, we have the most incredible peptides and hydrators. And when you look up there, okay, dark circles, under eye skin, they improve the appearance and the puffiness, optimize skin elasticity, increases skin hydration. And remember, hydration, I'm going to say this. This area here, you get these little tear trough deformity, which is a line right there, and you get sunk in it, especially if you lose weight. Now we're finding out, for all of you, you know, when you're using these GLP-1 and, you know, like, you know, any Monjaro, things like that, we're actually now, you hear about you got to keep in shape and you got to get your muscles going. But now we're finding out it also causes dehydration of the tissue and decreases some elasticity. So now is the time to, if you're using those products, really take care of your skin. Okay, so for everyone out there, the under eye smoother, you're getting 2 of these. I love, Lynn, that we're also doing free shipping and handling for, I think, probably everything on this show.
I want to say everything, Doctor. I'm going to double check on that. Yeah, all beauty. In fact, Donna's just showing you a little pea size, right, Donna, is all you need. What have you noticed it? What I've always noticed at this, obviously you have textured skin, puffiness, dark circles, things of that nature because of those ingredients. But do you guys notice your makeup goes on so much? Because when you have textured skin under your eyes, around your eyes, that's the area you notice when you put makeup on first, where it gets, you know, caught in the wrinkles and gets real dry. It doesn't happen with this smoother. Yeah.
No, the smoother has, I mean, my under eyes have just like exploded. I feel like the darkness is really diminished and the fine lines are diminished, and my makeup does go on so much smoother because it doesn't have that crepey skin that it's getting all stuck in.
Yeah, it's so true. And you're going to see Donna's before and after here. Even, you know, doctor, we're talking about, obviously, it could be dark circles, it could be puffiness, obviously fine lines and wrinkles, but really textured skin. Wow, this is live in the studio. I mean, you can see even the brightness. And you have ingredients in there that are addressing that as well.
You know, can I mention one thing about key ingredients, you know, and clinical grade ingredients? And again, I'm not saying anything about anyone else's skincare line, but when we put ours together, and when you look right there, especially with that special delivery system, that's the LIFTONIN XPRESS, it really is about the percentages and the quality of these peptides or antioxidants. They're not all made the same. And you want to make sure you get the optimal dosing, the percentage that's going to be clinically effective for all of you. So for everyone, I know we're running out of time here, lower eyelids, okay? Everyone comes to say, Dr. Nassif, let's take care of this lower eyelid, okay? Let's actually do something. Maybe we might do a laser. We might, you know, for the really damaged one. But if we can get you on something that's going to improve your whole skin health of lower eyelids, this is where you start.
Right here. That is, and nothing better than coming from the master himself, right? I mean, we so appreciate that and your honesty, and $20 off our original, our normal HSN price. This is normally for one is $60. So you're putting money back in your pocket today at $49.99 getting two. And I love showing all these before and afters because they are really, you know, some obviously difficult issues and areas, but you can see that smoothing effect. And this is just after using it twice